My name is Lillian Alidu. I'm a relationship, couples, and family counselor. Also a mental health counselor. So today we're talking about mental health. Before we start, I want everybody to pay attention. If you're outside, you're inside, please drop your pen right now. If you're holding anything, drop it. We're going to do a breathing exercise because I have to be calm. It's about our breathing. Are we ready?
Yes.
So we're going to breathe in. I will tell us what to do. We breathe in, we breathe out, but I want you to relax. Normally I'll tell you to close your eyes. To do that because it just helps to calm your nerves. So you're breathing in and you're exhaling your anxiety, anxiousness, panic. Are we ready?
Yes.
So in 3, 2, 1, breathe in, out. Your feet are fine, so loud. Breathe in, breathe out. Breathe in, breathe out. What is mental health? It's a well-being of your whole body. Socially, mentally, you have to be all right. If you are all right in one part and the other part is not all right, you're going to feel it. It's like having headache. Your leg might not be paining you, but you just know your body cannot function because you're having serious migraine, and that's what mental health is. And people tend to say mental health is mental illness. They are two different things, right? When people talk about mental health, don't shame them. You shouldn't be ashamed to say I can't talk about it because people say something is wrong with me. Mental illness are things that are diagnosed. We have bipolar disorder, that's mental illness. Schizophrenia, that's mental illness. These are things that we don't just handle by just talking. Sometimes they give people drugs, antidepressant drugs. So I'll start by telling you a story of a client that had a student that was suicidal. She was a young lady, she was 20 years old and she was suicidal. Why? When she was in secondary school, she was a very good student. She was smart, she was brilliant, everything was fine. And then she got into the university. Let's not forget, it's a new world. The lecturers were harder than how our secondary school teachers were. They would accommodate you, just a child. University, no. If you don't understand, go and read your book. So it was so hard for her that she couldn't go and she couldn't talk to anyone because her friends were doing well. And she saw her classmates that were doing better than her and she became sad. She didn't tell her parents, so she tried to kill herself by taking hypo. We all know hypo, right? And her parents contacted me and they had to have sessions. Now she's better, thanks to God. But this is what we need to talk about. I don't know how many of you have ever felt overwhelmed, stressed, sometimes angry to a point where you want to take actions but you can't. And you don't have to do like that. Okay. And that's why we're here today, because these are the things that affect our mental health. So I'll start by saying there are a few steps to take to protect your mental health. The first we're talking about is communication. I know we're students and we do English, right? Communication is you pass the message across and the person understanding it. That's communication. And I usually use this illustration. Since we have more of English speaking people here, if I was a French person and I come to you, don't understand French, and I'm speaking French to you, and you're just listening, just the way you're looking at me, now you're looking at me, I'm talking, but you don't understand anything. At the end of the day, I'll tell everybody that I've spoken to her, but you will respond and you don't understand. That's miscommunication. So in preserving your mental health, you have to communicate. It's a must. You must find a way to talk. And if you're talking, now you need to look for people that you can talk to. We have trusted people and have people that we can trust. We all claim to be good friends, but when it's time for us to show that we're good friends, we become bad friends. And that's when mental health plays in. People want to talk to you. Before you come to the part where you reach out to people like us as counselors, people want to talk to you. Are you the kind of person when they talk to you carry that talk and do gossip about? Or you laugh at them or you bring them down? If you're that kind of person, it is wrong. It's a community. Not everybody can see a counselor, but you can be a bridge where someone can say, I trust this person enough to talk to her and she will understand and it will not leave her mouth to another person. If your client dies based on suicide and you've been aware that this person is suicidal, you're in trouble, right? You're in trouble because once it has to do with suicide, it's not something you can control. It's like you send them for clinical therapy where they will be giving them drugs, antidepressant drugs to calm them down. But if you don't do any of that, which I know you are not equipped right now, except you study psychology and you get to a point after 5 years or 3 years, you can now say, okay, I know what to do. But still, even as counselors, we refer some patients that we know that their cases are critical for clinical therapy, because those people, they now put them in a kind of routine and then drugs to help them feel better. I don't know if you've ever heard people that, or seen people that hallucinate. Do you know what hallucination is? Like people that are mad, you see them walking on the street, they are talking to themselves, they are talking to them, they are okay. In fact, they don't know. That's the difference between mental health. You can tell I'm sad. Like when I have clients, young ladies, young guys, we can process emotions. When it has to do with hurts, trauma, healing, abuse, addiction, we can process it. But you see, hallucination is not something I will tell you, come and sit in my office, let me handle it for you. I'm not a clinical therapist or a clinical psychologist. No, I will refer you to a doctor. Right, so that's what I'm saying is so that even you as students, when people talk to you about things that are, imagine somebody telling you that I've been bleeding for the past 3 months, and as I'm talking to you, I'm about dying. You cannot handle that kind of situation. You must tell that person, trust me enough that let me go and help you get the right help. Right? That's what I expect you to do. So we're going to talk about practical tools to help you and your mental health. Oh yes, please, you're right. The first thing I would say is breathing. Like we just did. Breathing helps you. You're about to go into an exam hall, you're about to go in for an interview, you're about to go in somewhere and you feel tense. It is normal. Before anybody gets confidence to talk in front of a crowd, it started from way back. In practice, sometimes you stand in front of a mirror and say, I'm going to say it. You might go there and do something else, but practice. And now this breathing helps you to calm your nerves. It helps you. Sometimes even at night you want to say, try it. You do your breathing exercise and then you see that your body will be calm. That's why I say do it. Before I do any counseling session with my clients, physical clients, you must do breathing exercise, and you do that lying down and close your eyes. It helps you to be calm. Then set healthy boundaries. These boundaries is very important because we have a lot of